ADEC's Smart Start program offers first-time practice owners their deepest discounts on equipment and furniture for 2 years, plus other savings and complimentary services. Ask your ADEC rep for details and start smart with ADEC. Join Doctors Savanah Craig and Ronnetta Sartor as we navigate life beyond graduation. Real conversations about forging our own paths in our early years in our careers. There's a reason it's called practicing dentistry. Right. Welcome back to another episode of Beyond Graduation. I am Savanah Craig. With me as always,
I am Ronnetta Sartor.
All right, Ronnetta. So this has been on my mind, and I'm secretly hoping you'll have all the answers to this. When I wanted to go into dentistry, and part of the reason I did a residency is because I really wanted, and I know that you felt similar, to treat a wide range of patients with varying complexity and just be everything for everyone. And then you realize that you have limitations in a variety of ways, a variety of reasons to not be able to be everything to everyone. But recently I have had a lot of very complex patients come to my practice, either patients with developmental and disabilities or very, very sick in other ways, nonverbal, really, really elderly and really, really sick patients, cancer patients. Just it's been this microcosm recently in my practice, and I am trying to navigate the ethics of who to treat, when to treat, where to refer. Is some care better than no care? How do you, especially with special needs and elderly populations, the wait time for specialists or operating rooms is a lot. The fees and insurance, and this is a whole other thing of being in network. A lot of people need that financial assistance, and so they end up in my chair and just navigating when to do it, when not to do it, when to refer, where to refer.
Yeah, these are all great points. Yeah, they're great points. And, it's something that comes up very frequently too. What I have tried to do is if someone is a special needs patient in whatever realm, whether they just need a little extra TLC, I try to get all of the information that I can from a medical perspective to see if it's something that I'm comfortable doing in my office.
Yeah.
And if I'm not, then I just try to inform them of all the reasons why I'm not comfortable.
Totally.
But also not leave them hanging, but give them some resources to other places that may be able to help. I think where it gets really tricky, and you know this because you've been in South Carolina to see, and now you're in Ohio, and you at the college help out with special needs patients in the OR. But where it gets tricky is finding a place that can see these patients in a timely manner. Because I know here in South Carolina, if someone with special needs to go to the OR, sometimes there's a wait list of a year plus for that. So it's we want to provide, our heart goes out a whole bunch because we want to provide the care that they need, but in a safe manner.
Yep.
So I don't know that I have the answer either, but I can say that I completely understand, and it's something. You've been to my office before. In the town that I live in, we see a lot of the older population. So lots of medications, lots of health issues and that sort of thing. So as much as I can do in my office, I will do, but it's a lot of collaborating and consultations with their medical providers so that on both ends, I'm expressing to them the things I'm concerned about and they're expressing to me what they are concerned about to be able to do the best thing we can for the patient.
Yeah. And that's all you can do, but it's still so hard. So, yeah, so you were alluding to, I do some OR dentistry at the University of Cincinnati, and we take special needs patients to the operating room, but And I'm sure you kind of run into this too, with the only places to refer tend to be like these big academic institutions. And we did a ton of this in residency, but there's a lot of red tape as a provider. And then you feel so bad, or at least I do, of like, I will try. I will try to treat patients in the office if I feel like it is safe enough to try. But I tell the parents, I reserve the right to terminate this appointment at any point where I feel it's unsafe. I have sharp needles, I have
Right.
drills, I don't want to be the one that like traumatizes this patient or harms their loved one. Like, teeth are so important. Obviously, that's what I do every day, but it is not worth risking your life over. But then when those patients can't tolerate the office, because I think a misconception is levels of sedation and how that
Mm.
impacts our complex medical patients. Because
Tell me more about what you mean by that.
yeah, so family members who are looking for anyone to care for their loved one Google, right? And they find that I am an IV sedation provider in network with their insurance, and they think they've struck gold. And then you do enough Googling and you find that I have a background with these things, right? And so they come in and they're like, well, so and so has been treated under sedation before, like you can do it. And you find out with a conversation that it is OR dentistry that they've had. And here's the difference, right? Sedation in my office. Number one, it is me. I am all you have. If something goes wrong, there's no code team. There's no backup. It is me. And so I've taken some IV sedation courses where they talk about you are the pilot who flies in clear blue skies.
Mm-hmm. You do have a card, so to speak,
Yes. Yes.
with
And
medications and AED and that sort of thing. So
yes.
you've got your team as support, but you are correct. Yeah, you're the pilot.
And so there's that piece of it. The other piece of it is in-office sedation is a moderate conscious sedation, which is like blah, 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 blah. But you still are there with me. Like the way that this type of sedation works mostly is amnesia.
Right.
And so if you are someone who just needs brought down a level, in-office sedation will work for you. But if you need, due to a variety of things, if you need to be 100% unconscious, and especially our special needs patients who can have some tremors or uncontrolled muscle movements that are not their fault, my sedation is not deep enough to prevent those things. The other thing we find out is some of our most special patients have what we call a paradoxical effect to IV sedation.
Mm-hmm.
Which is where instead of my Versed making you nice and sleepy, it makes you super excited to be here.
Or my favorite, and a lot of females, not my favorite, but very weepy, even though they're not in
Emotional.
pain or anything like
Yes.
that. They'll be crying and smiling at the same time and saying,
Yes.
"You're not doing anything to hurt me. I just can't stop crying."
And so if you are someone whose brain works a little bit differently, where I can't reason you through, you're fine. Everything's fine. We're good. We're going. You're numb. Or you have these uncontrolled, to no fault of your own, IV sedation isn't safer. The other thing with IV sedation is we have an open airway. In the hospital, you are intubated. The anesthesiologist is protecting your airway and keeping you safe. And I just do my dentistry, and you are unaware of any of it.
Until
And
you
so
wake up.
until you wake up. And it is super, super safe because you're just not really there for it. So we don't have to worry about you moving unexpectedly or anything like that.
One of the things I wanted to add to that too, Savannah, is that in an OR setting, there's an anesthesiologist or a nurse anesthetist
There's
that's
so many people.
right. And those are the people that are making sure that patient's okay from a breathing and pain perspective. And in an OR setting, doctor has an even a more extensive team, and you're not, the only pilot in the cockpit. Pretty much,
Correct.
you focus on the dentistry and the dentistry alone, and you have support to help you focus on everything else for the patient.
Yep. And yeah, and so there are people who just need to be treated in an OR setting for their safety as well as my safety, right? But it's not easy to get an OR slot.
That's is so true. Like, I have a patient right now. So in my office it's different. So, we both were trained to do like IV moderate sedation. I still hold my permits and everything for that. But in my office, because I'm the only doctor from a capacity standpoint,
Yep.
I just don't have the capacity to still do IV sedation at this time. So
Mm-hmm.
what I do is conscious sedation with oral sedation, which is like a Valium or Halcyon plus nitrous oxide,
Yep.
or in other words, laughing gas.
Yep.
And so in my office, if patients can't have a procedure done with that level of sedation, then for me, it's a referral. But
Yep.
there are some patients, for example, I have a patient that has had a traumatic brain injury,
Mm-hmm.
and some of that sedation needs to be monitored. Like, if she were to need any extensive dental work, you know, she may be a case that needs to go to the OR setting to make sure. But she has a husband who is amazing, and he brings her in like every 3 months for us to clean her teeth.
Yeah.
Some days she have good days, some days she don't, and we just learn to work around it.
That's the other piece of this.
Yeah. And her husband is very patient, and he's grateful that we're patient with her too, and we're not going to ever push anything to kind of put her in a bad headspace or anything like that.
Yeah. The other, yeah, and that's the thing. You just do the best you can, but I think everything is about setting expectations, which I think comes with learning that you can't be everything to everyone. Is just being like, I'm willing to give this a try. If it doesn't work out, you might have to go somewhere else. Or I have a lot of elderly patients that teeth just run their course sometimes. And just telling them, like, hey, we can do XYZ to buy us time. And sometimes that's a hard conversation of like, how much time are we trying to buy? Like, let's, like, that sounds terrible, but like, or I had a couple of patients with cancer who don't have like emergent dental needs and needed consultations to go on some bisphosphonate medications to stop like cancer metastasis, and being like, do you want to come in and treat these couple of cavities? Do you want to not spend time at the dental office? Like, I don't know what's a priority to you. Or, would you do you just want your loved one to have their teeth cleaned and they don't really want these class 5 lesions taken care of? Or like, I've just ordered some SDF, and knowing that like we'll at least arrest some things. They're probably still going
Mm-hmm.
to catch some plaque, or like we'll put some GI over it, but it's not a perfect solution.
But sometimes doing something is better than doing nothing. And
Trying to know what
patient.
that is, that balance
Right.
is.
But I think part of it is collaborating, right? Like, if
Yeah.
I kind of talked about it earlier, like collaborating with their other doctors if you can, and then collaborating with the patient and their family member, because it's no one size fits all. It's just figuring out what's best for them at this particular time. It may change, but it
That's
may
a
say
really
for
good
right
point.
now, let's just try to do what we can that's the least amount of invasive, because there are some patients that their doctor will tell you, hey, they can't have any dental work done right now.
Yeah.
So then you mainly just move to things that are palliative and like preventive type measures to try to,
Yeah.
you know in your words, buy them some time.
No, I think that's a good point of like, at this time, because I think as dentists, we're trained to think 700 steps ahead of like, okay, we do this, and then when this fails, we'll do this, and then when this fails, we'll do this, and then I need you to know all of the pros and cons and risks and benefits of every single thing. But sometimes you're like, let's kick this can a little bit and see how we do, and put a
Mm-hmm.
filling on this front tooth to make it work.
So I know when I went to dental school, we had like a special needs clinic at our school where we would help see special needs patients. And so that got rid of a lot of the nerves surrounding that for me. So
Mm-hmm.
when it came time for residency, I feel like I was a little bit more confident in it. While you were in dental school, did you have any type of training with special needs patients or anything like that?
We had very limited because the clinic was like switching directors, and also it was COVID times, so things were very
Mm,
weird with that. So we didn't have a ton of experience until residency, and I think we did a really good job in residency of like trying when we could, and then I think we just had, and like our attendings, I think, had a really special place in their heart for those types of patients and would pull strings to get OR slots when they could with some like emergent things. But then you find out like in the real world your hands can be kind of tied. And I think that's the problem I have, is like going down to Cincinnati once a month is great and I'm doing something, but I always feel like I could be doing more, even though like I don't have the time or capacity or hospital privileges to do more. And that, I mean, that could be a full-time job. You could go to the OR
like
every day.
I don't go to the OR, but a few times a year, maybe quarterly, I'll go to the free
Yeah,
children's clinic, and that's not specifically for like special needs patients, but it's just for children who is in a middle place where they don't qualify for Medicaid, but
they
their
need
parents
help.
can't. Right, they need help. Can't they're kind of in between of qualifying for different type of insurances, and you'd be surprised the number of patients that are in that category too.
Yeah, it's hard, but I think like you said, you just navigate it the best you can and do the best you can with the situation you're in, and being honest about what you can and can't do for people. Friends, let us know how you navigate these challenges. If you know of any resources for patients who need a little bit more care. If you're interested in this type of thing, we would definitely encourage you to do a residency and try to get more comfortable thinking outside of the box a little bit. Any final thoughts, Ronnetta?
I think you summed it up really well. I think also, like, if you're interested in this type of dentistry and you're still in school, but you're looking at residencies, maybe look at residencies that are devoted specifically to that type of care, or it could be, in our case, residencies that's dedicated to seeing all different types of patient populations, but especially patients with complex medical histories.
All right, we'll catch you back next time.
Thank you for joining us for this episode of Beyond Graduation. If you enjoyed this week's episode, be sure to share it with a friend. Connect with us on social media at Savanah Craig DDS and at Dr_Sartor. And remember, you are not alone on this journey.
ADEC certified pre-owned equipment is a sustainable, affordable choice that makes genuine ADEC equipment available to every doctor. Each package is sold on a first-come, first-served basis. So, if you see one you like, contact your dealer. For more information, go to www.adec.com/find a dealer. Thank you for listening to Beyond Graduation, brought to you by Ignite DDS and Future Dentists. This episode was sponsored by Ignite DDS Coaching. We build self-determined futures. For more information, please reach out to the Ignite DDS team.